The ear is a part of the human body that contributes to one of the five senses of the human body, hearing. The ear plays a vital role in enabling the human body to detect sounds, which then travels through the ear canal and connects with the brain, delivering vital information. The ear is made up of three parts: the outer, middle, and inner ear. The outer and middle ear are involved in the process of hearing, whilst the inner ear functions in both hearing and equilibrium. Hearing works through the detection of sound vibrations which beat against the eardrum. The eardrum then pushes against the ossicles, which presses fluid into the inner ear against the oval and round windows. This movement sets up shearing forces that pull on hair cells within the ear. Moving hair cells open ion channels and stimulates the cochlear nerve and sends impulses to the brain, allowing the brain to decode these vibrations. Recently, through the development of technology, humans have developed ways to replace human ears through the use of stem cells and 3D printed technology. Children with ear deformities will soon be able to get printed ears made from their own stem cells, according to a team of Wollongong researchers working on new 3D bioprinting technology. As a part of the initial trial, a team led by RPA ear, nose and throat surgeon Payal Mukherjee will harvest the stem cells from discarded cartilage, which will be used to fast-track the development of bioink. The next step will be using a patient's own stem cells to grow the ear cartilage, and then print an ear that's tailored to their own abnormality and facial features. This development allows for individuals who have ear deformities to have a replacement. This will also help with the function of the ear and assist in physiological functions of hearing. Along with this new development to replace whole ears, the further advancement of cochlear implants has enabled people who have lost the ability to hear to have it restored. The world is currently in the most advanced state of technology it has ever been in, providing a wide range of improvements and developments, especially in the medical world. Children and adults who are deaf or severely hard of hearing can now be fitted with cochlear implants to help improve the individual's hearing. The cochlear implant is a small, complex electronic device that can help to provide a sense of sound to a person who is profoundly deaf or severely hard of hearing. The implant consists of an external portion that sits behind the ear and a second portion that is surgically placed under the skin. Cochlear implants bypass damaged portions of the ear and directly stimulate the auditory nerve. Signals generated by the implant are sent by way of auditory nerve to the brain, which recognizes the signals as sound. Hearing through a cochlear implant is different from normal hearing and takes time to learn or relearn. However, it allows many people to recognize warning signals, understand other sounds in the environment, and understand speech in person or over the telephone. Cochlear Limited announced that the next phase of its long-term research and development program towards a totally implantable cochlear implant, with the start of the further clinical feasibility study. The development of totally implantable cochlear implant technology is complex, and a commercially available product is not expected for years. However, it remains a long-term development goal for Cochlear. The totally implantable cochlear implant technology used in the clinical feasible study differs from existing cochlear devices available today. The new technology being studied includes an implanted microphone, an implanted rechargeable battery, and an implanted sound processor. This means that the patients can choose between using an external sound processor or taking it off and relying on the implanted microphone and internal sound processor, while still maintaining hearing function. A long-term goal for the company is to provide a product that provides totally implantable cochlear implant technology that will enable people to hear with and without any external worn components.